The chances of having severe reactions to COVID-19 are, of course, increased for many patients, especially those with heart disease.
Lynne Braun is a nurse and professor emerita at Rush University, and she's joining us now with some things you need to know. Good morning.
Good morning. Thank you for having me.
So we've heard people with pre-existing conditions are at more risk for the extreme symptoms of COVID-19. Heart patients more so?
They are. Well, heart disease is a chronic condition, just like other chronic conditions, and it makes individuals more susceptible to developing the virus if they are in close contact with somebody who has it. Having heart disease or having the virus with heart disease increases a person's metabolic rate. So that means that the heart has to work harder, leaving it more susceptible to having complications and an increased mortality rate for those with pre-existing heart disease.
Lynne, is there any information out there right now? I know we are just starting to learn more about COVID-19, but any information out there about medications that we might be taking for our health that might be contributing to becoming more susceptible to COVID-19?
There's been a lot of information going around the internet about people who take the blood pressure or heart failure medication ACE inhibitor, as well as people who may take non-steroidal anti-inflammatory medications such as ibuprofen. A lot of this information has arisen from some observations or some observational studies. None of this has been proven. In fact, the American Heart Association, the American College of Cardiology have come out with statements about people who need to take ACE inhibitors for their blood pressure, not to stop those medications because they're important for blood pressure or heart failure. Similarly with ibuprofen, if someone feels more comfortable because they're concerned about what they're reading, they can take Tylenol as a fever reducer or a pain reducer. But right now, we don't have enough data to support what is being said.
So we know social distancing, isolating yourself. Is there anything more that heart patients should be doing?
Heart patients should be doing what the CDC recommendations are and what the governor of Illinois tells us to do, and Mayor Lightfoot. In addition to social distancing, patients with heart disease should stay inside as much as possible, or most of the time ask someone who they live with or someone else to go grocery shopping for them or have their groceries delivered. They need to make sure they're up to date on their vaccinations, including the influenza vaccination, which we've always recommended for heart patients. And if they're 65 years of age or older, and the pneumovax vaccination as well. They need to wash their hands frequently and make sure they sanitize all surfaces in their home.
All very good things to think about and put into practice. Lynne, thank you so much for joining us this morning. Do appreciate your expertise.
Thank you very much. Stay safe.
You too.
Right. For more information, you can visit the American Heart Association's website, heart.org.